Now, an Aberdeenshire mother who spent thousands of pounds on private treatment for her daughter who has long COVID has told Drive Time that children with the condition are being badly let down. Helen Goss's daughter Anna developed long COVID over 3 years ago. She's been bedbound for the past 3 months. The 10-year-old, now in primary 7, hasn't been able to go to school since she was in primary 3. Helen, who runs Long COVID Kids Scotland, has spent £10,000 on private treatment for her daughter after struggling to get NHS help. She herself has long COVID. Before we came on air, Helen told me Anna's health is worsening.
She is not doing well right now, actually. 3.5 years into this, she's got 3 COVID infections under her belt. And at the moment, she's actually the worst she's ever been. She's almost completely bedbound at the moment, and she has been for about 3 months. And it was just yesterday, actually, that we managed to secure a new diagnosis and treatment for her. She's got POTS, which is really common after COVID infection and common in long COVID. It's postural orthostatic tachycardia syndrome.
Well, how would you describe her condition?
Well, she's just been in bed for 3 months. Her body's just really in a weird, messed up cycle. It can't seem to regulate itself. She needs this new medication to help her do that. Whenever she stands up, her heart rate shoots up through the ceiling and her blood pressure tanks through the floor. It makes her sort of faint. Her vision goes weird. She gets dizzy. She feels really sick. It's so debilitating. So she's just sort of lying in bed, flat, pretty much.
How are you getting on with accessing treatment?
Through the NHS, we're not, pretty much. Privately, we've had to pay for every treatment that she's had. We've had to pay for a private immunologist, neurologist, cardiologist, a private GP. And all of these things should have been available through the NHS, but a lot of her referrals have been denied or refused, or clinicians simply don't know what to do, which isn't their fault. It's a systemic failure of the Scottish Government, honestly, to fund long COVID services and train.
They say that they are funding long COVID services in each health board area. What's your experience?
That's funny. You can't fund a long COVID service with the funding that they've provided. It's 3 million per year and there's 14 health boards. So when you split that up over the health boards, it really isn't very much.
How are you getting on with Anna's education?
I actually met with her school yesterday, which was really great. I'm feeling like we're turning a corner with her education. She's basically had 2 years of nothing. And it's been a massive, monumental fight with Aberdeenshire Council to try and get some education provision for her. They've not been particularly supportive. And it really is down to the goodwill and support of the school staff, who are actually trying really, really hard to find a way to provide her with some education. So they're setting up a Teams channel just for her, which is going to be amazing because she's so isolated. She hasn't been to school since primary 3. She's now supposed to be primary 7. She hasn't seen her class for years. And it's, just bridging that gap. I just really hope it's going to make her feel part of the school community again.
And Helen, you obviously work with Long COVID Kids Scotland. How would you describe the levels of support for young people who do have long COVID? What's your experience been? What stories are you hearing?
Really quite harrowing stories, honestly. Long COVID kids are the support. There are no paediatric long COVID clinics. There is nothing out there except for our charity. And every single day, I see messages from parents saying that they've maybe waited a year to get a referral to paediatrics, but then the paediatricians are not sure what to do or how to treat. And they quite often get very basic diagnostics done and then are discharged. It's so disappointing that we're so far into this now. We know a lot about long COVID. We know a lot about what treatments can be prescribed to help manage symptoms, but families are not able to access this unless they go to private services who are knowledgeable.
So you've paid for private treatment?
Yes, we've paid around about £10,000 now, I think, roughly, for lots of different private healthcare experts which should have been available through the NHS, but unfortunately are not.
And if people can't afford that?
We have low-income families in our group, and it is just so awful to see the health inequality. If people can't afford to go private, they literally just have to sit there at home and fend for themselves, and their only support is Long COVID Kids Charity. Sometimes we advocate for them on their behalf and try and get them some help and support in the community and the NHS. It is such a battle and it is exhausting.
Do you feel a bit forgotten?
I think we all do. I honestly think the Scottish Government need to take their heads out the sand and take long COVID far more seriously. They need to get the public health messaging out there, because parents just aren't aware of long COVID and what it can do to your kids. We know now that repeat COVID infections cause cumulative damage. So they may be fine on their first, second, third COVID infections, but they might develop long COVID on their fourth or their fifth or their sixth. And it's so debilitating. It's life-changing. Parents need to be aware of this so that they can take their own informed risk assessment for their own families.
That was Helen Goss from West Hill in Aberdeenshire. Both Helen and her daughter Anna have long COVID. NHS Grampian told us the Health Board has a paediatric long COVID steering group with a draft clinical pathway to be approved. We've appointed a long COVID coordinator and are currently recruiting to the clinical lead post. The Scottish Government said primary care clinicians can refer to occupational therapy or physiotherapy for further support where appropriate. In cases where referral to secondary care is required, children and young people may be referred to general paediatric services. We are making available £3 million from our £10 million long COVID support fund over this financial year to support NHS boards.